Good morning. Today is Wednesday, September 25th, and I'm getting ready to go meet with my oncologist and go over blood test results and talk about maybe potentially having a bone strengthening treatment. Hopefully not yet. I don't think I need it yet personally. And just talk about stuff. And I also, after that, have to go get a Zoladex injection. So I'm going to get on the road and I'll see you in the next clip. So I'm in the exam room. Blood pressure and pulse ox were all good. It was like 109/72. I forget, 109 over something, which is kind of high for me. Normally I'm really low with blood pressure. I don't know why. I'm gonna give you a room tour real quick before my oncologist comes in. Room tour. And here is where I'll be sitting. And we're gonna talk about blood work results, how I'm feeling probably on all these medicines and the Verzenio, diarrhea, and all that fun stuff that I kind of have under control now. And I'm probably gonna get a blowout now that I said that. But yeah, I'll let you know what we talk about. I'm also gonna mention, which I didn't tell you guys yet, but my right eye is still getting blurry at night. So I have an appointment next week with an ophthalmologist to look at it and see what's going on, because my oncologist here in a previous visit did say that Taxol chemotherapy can really affect your tear ducts in your eye. And I'm like, I haven't been on Taxol since January. It's September and I'm still having effects from it. So I might need a prescription eye drop, because what I'm using just isn't cutting it for nighttime. During the day, it's fine, but at nighttime, it gets real blurry. I don't get it. Maybe I'm just getting old and need glasses, or maybe I have astigmatism. Who knows? But we're gonna find out. All right, so I'm gonna meet with her and then I'll see you in the next clip, because after this, I have to go get an injection right in my gut. All right, I'll see you in the next clip. Okay, I'm all done this appointment. Now I'm gonna go upstairs and get an injection right into my gut, Zoladex. So I'll see you in the next clip. So I'm in the room and I'm doing a super fast room tour because they're going right now to get my shot. So I'm gonna get injected and I'll see you in the next clip. Okay, so I am back in the car. Let me just do a brief update of my visit and then I'm gonna get on the road because I have another appointment tomorrow that I'm bringing you along with me for. So with the oncologist appointment, everything went really well. I talked about my right eye having chronic dry eye at night, because every morning, doesn't matter. I wake up with my eyelids feel like sandpaper, both of them. And the only way to open them comfortably, I sleep in between my pillows, I sleep with a bottle of eye drops. And I put a little drop here, and in the morning, I'm like this, I can't see. So I feel, not even kidding, put a drop in here and I'm moving it around, and then I'm like, okay, and this one's good. Then I do the same to the other side, move it around and blink, 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 and then I can open my eyes for the day. Every day. And that's not normal. So I know as we get older, our eyes get drier, because I'm picturing, if you watch SpongeBob at all, there's an episode where Mr. Krabs, there's like a song playing in the background and it's like, because you're old, and he's got all this crust on his eyes and he's like, oh geez. Anyway, that's me in the morning every day. But like, I'm sorry, but 40 is not old. Mentally, I'm still like 21 to 25. And I feel like I feel that way physically and look that way too. But 40, you shouldn't be having these crusties. I'm thinking like 60 and up is when that's supposed to happen. Maybe I'm wrong, but I'm getting my eyes checked out, and she agrees. Yes, go get them checked out. Sorry, I'm getting my coffee. I need a little sipperoo. What else? So blood work looked good. Now I go monthly for a blood work follow-up just to keep an eye on my levels from Verzenio. So like keep an eye on my white blood count, my neutrophils, red blood count, all that stuff. Hold on one second. Delicioso. And then what else did we talk about? Oh, hair thinning, because I want to show you. I think I did show you. I forgot if I showed you or not, but I have this like random bald patch right here. Like right there. It's just like this little line. Here, let me pull this down too. It's just random. And she seems to think that it was, because I did wear like this headband for a couple days and it was tight and I kept moving it around. I think it wore away hair like a month or two ago, because when I look at it really closely, little teeny tiny spikes are coming up, but not all over. Anyway, she said if I want to go have dermatology check it out, and if it's any type of like a dermatitis or something, not dermatitis, but something dermatology related, they can inject like a steroid underneath here to stimulate blood flow and to stimulate hair growth just in that one spot. But I'm gonna try coconut oil and rubbing it and stuff and just give it a little minute and see if it comes back naturally. If it doesn't in the next couple weeks, like if I don't see spikes coming up in the next couple weeks, I'll make an appointment to have it checked out. But I can cover it with, I have a lot of hair. I'm like, I have really thick hair, and it's surprising that this one spot's just not coming in. So I don't know. The other thing we talked about, I'm just like I look away because I'm like going through my mental notes. I'm scheduled to get a bone strengthening treatment. It's the Zometa, I think that's what it's called. It's an infusion. So the next time I go in for my injection, which I got an injection today in my left side of my abdomen. I'll show you real quick, right down here in my gut. So the next time I go for that, it'll be on my right side, and I'll also be getting this infusion. And what this does is it helps keep your bones strong, because being on low estrogen medication or anti-estrogen meds, so the hormones that I'm on, they can cause bone thinning over time. So this prevents that from happening, and also strengthens your bones if it is starting to occur and we just haven't caught it yet. Because I had a DEXA scan done like 2-3 months ago now. So this is just to stop it from getting worse if it has already started, or to prevent it from starting, if that makes sense. Also, both my oncologist today and my oncology nurse who gave me my injection, they both said, without even talking to each other, that this Zometa has been studied and proven to help reduce the risk of recurrence of breast cancer. So there's another plus for taking it. And then, I have the concerns about necrosis of the jaw, necrosis of your bones, or like your femur. And she said in the 40 plus years that I have been administering chemotherapy and administering Zometa and bone strengtheners, she said she saw one patient, and it was an older patient, like geriatric technically, have the necrosis of the jaw, and it was very mild, but it was out of how many people? She's like, it is extremely rare. It does happen, but it is extremely rare. She said, just make sure, you keep on top of your dental appointments, and if there's any major work that needs to be done, we hold the Zometa. We want you to heal from that. We don't want you to get necrosis of the jaw or necrosis of anything. So they keep a really close eye on the patient, which I appreciate. What else? I think that's pretty much it. Yeah, I just go monthly for blood work from here on out. I'm gonna have the bone. Oh, before I have my exchange surgery in December, my oncologist said she will most likely hold the Verzenio for 2 weeks before, just to give my body a chance to get some white blood count built back up. She's like, it's on the low end. She's like, but this is not uncommon at all with Verzenio. And if you look at the trends, like I said in my previous vlog, that my app shows you every single one. So you can see every white blood count reading I've ever had, or neutrophil reading I've ever had. And it's been consistently around like 2 to 4, like a 2.4 to like a 4.1 ever since January. So like this was before Verzenio even entered my life. So obviously being on chemo, your white blood count goes in the tank. But when I had my my bilateral mastectomy surgery and my expander surgery, my white blood count was like 2.8, 3.0. Like it wasn't high. It wasn't in like the normal range. It was normal, but it was very, very close to being in the low range. So she wants it to just be at a comfortable number before surgery, because I go for pre-op screening, which where they check your blood work and your vitals and all that and your weight. Pre-op screening, I want to say November 20th. I forget what day. I think it's that day. But when they'll check my blood levels then, and if they're like still not doing that great, she's going to hold the Verzenio for 2 weeks and possibly a week after, just to allow for wound healing. So that's good to know. So we're covering all our bases, making sure I stay healthy and happy as much as I can. And that's it for now. So I'm going to hop off, but don't go anywhere, because tomorrow is another doctor appointment. I am getting another fill in my expanders, and I'm going to look at them and try on a bra that I think is suitable for my body shape and size and my goal of what I want my breasts to look like. And if I'm satisfied with how they look, tomorrow will probably be the last fill for size, and then we'll do 3 more fills after that to stretch for skin. So they're going to be bigger, but I'm not going to be that size after the exchange, because we need that extra skin to tuck in with the exchange surgery. So much medical stuff. My brain's like, all right, and yours is probably too. But this is just a little sneak peek into my life, in case you are going through the same journey. This is it. This is the life of breast cancer and life after. All right, so I'm gonna go, but I will see you tomorrow morning for my next appointment. See you in the next clip. All right, so today is Thursday, September 26th, and I am officially, look at the little baby doll back there. It's my daughter. Every time I take her to school, she's like, can you put my baby in the car seat and buckle her in? I don't always buckle her in. She's like, and then when you pick me up, I'll just be your mom again. She's so funny. Anyway, getting ready to head out to my expander appointment. So let's get on the road, and I'll see you in the next clip. Okay, so I'm in the exam room, not the procedure room this time, just a regular room. So here's a quick little room tour. Oh, look at the picture. Purple flowers, my thing. Here's a room tour. That's all the stuff they're gonna use to access my expanders and put the saline in. They access through the self-closing port, and it's this cool little like hose tube thing that goes into a tiny little butterfly needle. They have a little magnet thing that finds the port so they don't pop the expander because then it would leak and I wouldn't have a boob. So it's really cool how it all works. But that's the room tour. I'm gonna get expanded and I'll see you in the next clip. Okay, so I just got filled and now they're starting to have some projection, which is good. So I'm gonna guess maybe like one or two more fills, and then that's the size I wanna be. So I'll have to go 3 more fills past that for the skin to stretch for the exchange. So good, I'm almost there, yay. And there'll be less doctor appointments because I have a million doctor appointments still, even though I'm like done most of my cancer treatment. It never ends. Anyway, I'm gonna check in from the car, so I'll see you in the next clip. Okay, so I am now back in the car and I'm going to close out this video here. So that completes this week's doctor appointments. Next week, I have a lot going on. And I remember I was saying, oh, I can't wait till my daughter goes back to school so I can start recording more content for YouTube. Well, I've had so many appointments. Like every day I have something going on, whether it's for myself, for my dog, for my daughter, for the house, like literally, or the business. There's literally something every day. So I apologize that I'm super behind in my own personal goals that I set for myself for this YouTube channel, to be putting more exciting content out, or different content, not just vloggy type content. But next week I have, on Tuesday, I go early in the morning to have my eyes checked at the ophthalmologist because of my chronic dry eye in this eye. Then the next day, my dog has a vet appointment in the morning to just to get a checkup. He's getting older, my little Harley, but he's a Yorkie and he just turned 8. And I'm noticing his eyes are reflecting light a little differently, so I'm wondering if he's starting to get the beginnings of cataracts. I don't know. It's kind of young for cataracts to be starting. 8 years old and a Yorkie. I don't know. And I always like to check his teeth because his teeth have been really good, but Yorkies are very prone to dental issues. He's not my first Yorkie, and his teeth look really good, but I just want to get his teeth checked. He also has the beginnings of arthritis in his back left leg, so I just want to get him checked. I like to keep my babies, whether they have fur or skin, in tip-top shape and always checked out and healthy, of course. So that's Tuesday. And then Wednesday, I don't think is anything, but Thursday is another fill here. So I will bring you along with me next week for my appointments. And then my daughter's birthday will be coming up in the next couple weeks. Like, it's just nonstop. It's nonstop. But I just wanted to let you know, thank you so much for being here with me on my journey and just hanging out while I'm going through the motions of life. If you are just finding out today that you have been diagnosed with breast cancer and you happen to stumble across my video, I have a whole entire journey recorded from diagnosis day to now of what life is like when you have breast cancer, what you will be up against. Every breast cancer treatment is kind of tackled differently. Mine, we did the treatment first and then the surgery. Some breast cancer types, you have the surgery first and then you go for treatment, whether it's just radiation or just chemo or both or hormone therapy. It's all different. It's all based on the stage. It's based on whether it's hormone receptive or not. If it's triple negative, that's a more aggressive type of breast cancer, so they attack it more aggressively treatment wise. So everything's different, but you can follow along my journey and see, you know, I'm a mom, so life goes on while you're being treated for breast cancer. It is not typically a death sentence. I don't want you to feel fear when you are diagnosed with breast cancer, because I'll tell you what, your mind is the most powerful tool. It is literally 50% of the battle. I truly believe that if you can think it, you can be it. And I stayed positive, and I'm still staying positive throughout this whole journey. The whole journey. There were some times where I felt like sad or angry or scared or frustrated or just tired of it. Like I'm just, even now, I'm like, I'm freaking tired of it. Like it's been over a year now of constant doctor appointments. But guess what? I also like appreciate it because that's what's helping to keep me alive and healthy and monitored and making sure there's nothing suspicious growing and making sure we are doing everything we can in our power to keep cancer away from me and out of my body and not recurring. So I appreciate that. As annoying as it is to have to go to the doctor multiple times a week, every week for the rest of my life. No, it just feels like it right now. Whatever, I'll do it. I don't care. I will do it, and I'm doing it because I want to live and I want to be as healthy as possible. So anyway, I'm rambling, but if you are just finding out today that you have breast cancer, I want you to know that you're going to be okay. Do what your doctors tell you and take care of yourself. Try to do some research on food because I kid you not, there is so much curse word SHIT in our food that I swear to God, that is part of our epidemic that's going on right now where everybody young is getting cancer, whether it's breast cancer, ovarian cancer, lung cancer, colorectal cancer, testicular cancer, like young, like under 40. It's unreal. And I swear it's part of it is some of the food that we're eating. So people are walking by my car, so I'm just gonna slowly tuck this down real quick because they're probably like, are you recording me? No, I'm recording me. Anyway, do your research on food. Try to eat as fresh and organic and healthy as you can. Drink a lot of water. You want to stay hydrated. If you're starting chemo or radiation, you definitely want to be as hydrated as possible. I'm not even in any of it, and I still stay as hydrated as possible. This is a 1.5 liter, and I try to drink 2 of these a day. Like, it's 8 o'clock in the morning right now, and I already drank this much, and I plan on drinking more. So yeah, just take care of yourself. Do your research. Make sure you try to take some stress out of your life. I know life is stressful, but if there are any toxic people in your life or like a high stress anything, try to just take one thing off your plate because stress is a beautiful breeding ground for a lot of issues in our bodies, not just cancer. But anyway, I want you to know that you're going to be okay. Take things one day at a time, one step at a time, one treatment at a time, one infusion at a time, and give yourself grace because there are going to be days where you wake up and you just don't want to do it. You're not going to want to do it. You're going to be like, what's the point? This is stupid. How do I know it's working? Just have faith. Have faith, believe that you are going to do this. You are going to be okay. The cancer is going to leave your body. This chemo or the surgery or whatever you have to go through that is scaring you right now, it's going to take it away. You have to think that and you have to believe it and it will come. Okay. And I love you guys so much. I hope you are doing well and I hope you're having a great week. And I hope this video helped you or someone that you love and care about in some way, shape, or form. I hope all my videos help you in some way, even though like the vloggy ones are kind of repetitive. It's still what I'm going through, and I'm a breast cancer survivor, so still going through it all day, every day. And I take medicine every day for it, but that's okay. That's what I have to do, and I'm fine with that. So, all right, I'm gonna go, but I will see you in the next one, and I better see you in the next one. Bye, everyone.